Most people think that a facelift is just about pulling the skin, but that's not how facial aging works, and that's not how modern facial rejuvenation should be approached. As a board-certified plastic surgeon specialized in advanced facial rejuvenation techniques, I see many patients in my consultation who come in thinking that a facelift is simply a skin procedure, when in reality, aging happens much deeper. That's why today I want to walk you through the science behind the deep plane facelift, what it is, why it works, and who truly benefits from it. Deep plane facelift is about understanding facial anatomy, aging patterns, and restoring structural support in a way that looks natural and also ages well. And natural results are often the result of overfilling the face, too much pull on the skin, or procedures that don't really address the structure and signs of facial aging. So to understand deep plane facelift, we need to understand first how the face ages. Facial aging is not just the skin tissue, it happens in layers over time. There's remodeling of the deep bone structure, the ligaments loosen, and the skin gradually loses elasticity as collagen decreases. As these deeper tissues descend, the skin follows, and this is what creates jowls, mid-face flattening, and loss of jawline definition. So what does the deep plane really mean? This term refers to the surgical layer where the work is performed. So this plane lies beneath the skin, and it includes the SMAS, which is the tissue that envelopes the facial muscles, the deep fat compartments, and the retaining ligaments of the face that need to be released during surgery. In a deep plane facelift, the face is mobilized and repositioned as one single unified structure. We restore the anatomy instead of simply rearranging the skin, and that's why this approach respects the facial anatomy and preserves the natural expression on every case. So what's the science behind these natural results? From a biomechanical perspective, the deep plane changes everything. The tension is redistributed not only over the skin, and that's why it is allowed to be retracted naturally without tension, and that makes the scars look more natural, the tissue better preserved, and healing tends to be much more harmonious. Traditional facelift or mini facelift techniques often focus on skin tightening and superficial layers, but the correction of the jowls, the mid-face support, and also neck definition and jawline contour are not addressed with the same level of precision and longevity as with the deep plane facelift. That's why the overall result is always more balanced, more structural, and more three-dimensional in a deep plane. So if you'd like to know more about facial anatomy and personalized rejuvenation options, you'll find additional information in the description below. Thanks for watching.